Today, I am going to give a presentation on a very important medical device, the oxygen flow meter. Let's begin. Oxygen flow meter is a medical device used to regulate and measure the flow rate of oxygen being delivered to a patient. It ensures the patient receives the correct amount of oxygen as prescribed by the doctor. Definition: an oxygen flow meter is defined as a device that controls the flow of oxygen from the oxygen cylinder or wall outlet to the patient in liters per minute, LPM. It is usually a part of an oxygen therapy system. Parts of the oxygen flow meter. The main parts of an oxygen flow meter are 1. Flow regulator knob. 2. Glass or plastic tube with LPM markings. 3. Ball or bobbin that shows flow rate. 4. Humidifier bottle, optional, to moisten dry oxygen. 5. Outlet connector, attached to nasal cannula or mask. Working principle. The oxygen passes through the flow meter where the flow rate is adjusted by rotating the knob. The floating ball rises to indicate how much oxygen is flowing in liters per minute. The nurse must read the ball from the center to get an accurate reading. Normal flow rate. Flow rates vary depending on the patient's condition. Nasal cannula, 1 to 6 liters per minute. Simple mask, 5 to 10 liters per minute. Non-rebreather mask, 10 to 15 liters per minute, 15 liters per minute. The doctor will decide the rate based on oxygen saturation and medical need. Role of nurse. As nurses, we must check the oxygen source and flow meter. Set correct LPM as prescribed. Ensure humidifier has clean distilled water. Monitor the patient's oxygen saturation using a pulse oximeter. Observe for signs of oxygen toxicity or discomfort. Precautions. When using an oxygen flow meter, remember, never use oil or grease near the oxygen setup. Avoid sparks or flames. Always use clean, dry hands. Secure the oxygen cylinder to avoid falls. Check tubing for any leaks. Conclusion. To conclude, the oxygen flow meter is a simple but essential tool in patient care. Proper knowledge of its use helps in safe and effective oxygen therapy. As nurses, we must use it accurately to ensure the safety and recovery of our patients. Thank you, Slide. Thank you for listening.